Okay, anyone who is joining for the first time today? Okay, Gaurav is one. Anyone else? Okay, Jalaj is one. Okay, Farooq sir is also one. Okay, so we have uh three, three, okay, six almost. 6, 7 people who are actually joining for the first time. In the beginning, I would like to lay some ground rules for this session. The ground rules are, for example, if you are not in a comfortable position and a presentable position, please don't open up your camera. I would rather suggest that you just, mute yourself. Do not open up your camera. And you can, if you have any question, just raise up your hand. You can write it in the chat box. That will be okay, right? So we have 2 sessions that are in continuation. On Friday, we have a question answer session. And on Saturdays, that is especially today, and it will be in continuation, we have mock sessions. What are mock sessions? Basically, these are role play sessions, right? What do I generally do? I prefer that in one session, I give you a case, and that is a mock session, right? It's a role play session. In the next session, I give you the solutions for it. I actually tell you what is that case all about and all the details in journal, right? So you complete that topic in one go. So that is my sense of taking this mock session, right? So last time we have started with an ADHD case, and now we are in continuation to that, right? I truly admire people sitting with a notepad and a pen. Those who are not sitting with a notepad and a pen, please get it, because I will be telling you about the details, what is a ADHD, what is there in ADHD symptoms and everything all together, right? So it's better that you take a notepad and a pen with you, and I would be sincerely advising that, right? Again, if we have time, so Pavandeep, actually, we are recording this session on our part also. So we will be providing you the recording. So that you can just ask to Pratishta.
Sure.
Okay. Another thing is that after I wrap up the session, like my part is over. So if we have time left, you can ask questions also. That would be much easy for me, right? So let's get into a blended learning that initially I started to take the class. And then after that, if you have any questions, and if the time is there and its feasibility is there, then you can ask questions. You can raise up your hand, post it in the chat box. That is the way I take up questions. Okay. In the beginning, I'll just, okay, so there are few queries, chat box. Okay, Manjusha is also a first time attendee. I think I've explained, Manjusha, what you have to do. And Ronnie, is it possible to paste this recording after the class? That is completely an administrative call. So you can, Pratishtha, are you here?
Yes. So guys, this Zoom recording takes at least an hour or so to get processed. So you will get the recording on Monday in your portal itself. Right?
Okay, ma'am.
Okay.
Okay. Yes, Vaishali. Vaishali, I assume you have a question. Okay. Okay, guys. So let's get started. Everybody is having a notepad and a pen with them.
Yes, ma'am.
Okay, wonderful. Let's get started. So
Yes, ma'am.
okay, thank you so much, everyone. Last time we were discussing about an ADHD case. Now, in detail, I would let you know what is an ADHD case. First of all, what do you mean by ADHD? You can start writing. So, ADHD are basically 2 words which are written in hyphen. Although that hyphen is not mentioned, but these are 2 words altogether. AD and HD. AD means attention deficit, when attention is not there completely, deficit is there, and hyperactivity disorder, right? So it's a combination of 2 things. ADHD, now we begin with ADHD. So start writing. ADHD can have 3 parameters. One is hyperactivity, Second is inattention. Third is irritability. I'll just repeat for the ones who are writing. So it's hyperactivity, then it's inattention, and then it's irritability. Right? Now I'll just explain to you with examples. Just give me a minute.
Hi, can you just repeat it once again?
Yeah, I'll do that. So we have hyperactivity, inattention, inattention, and irritability. Right? Okay. So now beginning with hyperactivity. Okay, now what do you understand by hyperactivity? Hyperactivity basically means that you are too hyperactive, and there are parameters under to that, but just a layman language or a common language, I'll tell you. Hyperactive basically means that you are too active, that you are not able to sit in one position, right? And that hyperactivity is due to genetic causes. Right? So neurodevelopment, this is a neurodevelopmental disorder. Neurodevelopmental disorder means it's coming from your genetics, is coming from your physiology, right? So there is no external cause to that, more of an internal cause. Right? So that neurodevelopmental means, if I break that word, neuro is the nerves, the working of the nerves or the cause of the nerves. Developmental means as you grow up, your symptoms go worse. Right? So that is neurodevelopmental disorder. Now, what do you mean by disorder? You live in an orderly fashion. You live in a routine fashion. You have a discipline in life. When that discipline or routine get disturbed, that is a disorder. That is why with every term we use disorder. That means it disturbs your orderly fashion. Is it clear? Okay, fine, perfect.
Yes, ma'am.
Now, Ron, you want to ask something? Okay,
No, ma'am, just acknowledging.
okay, perfect.
Ma'am, number one is hyperactivity. Number two is what, ma'am?
Inattention. 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 I
Number-
just write it down.
The
I'm
third
writing
number?
in the chat box. Inattention. Then there is irritability, the last one.
Excuse me, ma'am. Anyone helping you can side by side type in the chat box some bullet points, if is it possible?
Yeah, I mean, if anybody wants to, because they are also just jotting down their notes. So if anybody can help, that would be, I would rather appreciate. But if you can't,
Your subordinates.
okay,
Anyone?
no, nobody is there, because
Okay.
Pratishtha will be there only for 10 minutes. She is into administration. She will. I'll do that.
Okay.
Don't worry.
Okay, no problem, ma'am. Thank you.
Oh, okay. So then please focus. Now we start with all the details. The first one is inattention. What do you mean by inattention? When your attention is diverted or your attention is not sustained. Either your attention is diverted or your attention is not sustained. That is inattention. Now I am giving you the keywords, right? So these are the keywords for that.
Excuse me, ma'am.
Yes, man.
Ma'am, can you please repeat the definition of inattention?
Okay, inattention means either your attention is diverted from one thing to other, or what did I just say? Or your attention is not sustained. Yes, Alkendu.
Ma'am, is it only a genetic order or it can be gained since birth?
If it is genetic in nature, that means it's from the conception only, from the birth.
Actually, what I wanted to know is that my son is suffering from ADHD and mild autism. That is what NIMHANS has diagnosed.
Alkendu, I'm sorry to cut you short. Can I, take this conversation after I complete this? I'll just
Yeah,
tell
sure.
you.
Yeah, sure.
Okay, thank you so much.
But
Okay.
don't forget it, ma'am.
I'll do that. I'll do that. As soon as I wrap it up, I'll just come to you all. Yeah.
Okay, okay. I'll
Okay.
be there till the end of the meeting.
Okay, okay. No worries, no worries. If it exceeds to 10 also, I'll take it up. Don't worry.
Okay, thank you.
Okay. Inattention is basically, I'm so sorry. So there are number of symptoms that are there. Start writing and I'll tell you. So in inattention, the first symptom is fails to give attention or does careless mistakes. Fails to give attention or does careless mistakes. Now, what do you mean by fail to give attention? If I am, let's understand, if the name of the child is, let's say Nancy, I'll take my example, okay? And I'm calling out the child's name, Nancy, and maybe she's listening, she's receiving, but she's not looking at me, right? So fails to give attention. Second, does careless mistakes. Now, careless mistakes could be anything. Maybe she gets holds of a pen and she falls it down, or maybe in education, any careless mistake, right? So that will count it. Okay, people are writing something in the chat box. Yeah. Okay, so people are helping. Thank you so much. The second point is difficulty in sustaining attention. What is difficulty in sustaining attention? For example, I have to write in an examination. I'm appearing for an examination and I have to sit there for 1.5 hours. My attention is not sustained. After 10 minutes, I will feel restless. After 15 minutes, I will feel less rest. One more thing I wanted to tell you, individual differences are there. For example, if I am an ADHD child, maybe my attention is for 20 minutes. If somebody else is an ADHD child, maybe his attention is for 25 minutes. So it differs. I'm just giving you an instance. Always take into account it differs, right? Third is often lost when speaking directly. Lost as in you are telling him or her simple instruction, but he's just completely lost in his or her own word, right? So he is not giving attention to you. Again, lost means daydreaming, basically. Here, specifically, I have to say that it's daydreaming into their own utopian world, right? Next is do not follow instruction. Again, if you give direct instruction also, Nancy, go and get a glass of water, no instruction following, right? Next, difficulty in organizing tasks and activities. If you give them any kind of organizational activity, even the smallest of that, for example, they have a bucket of toys and those toys are lying in the room. If you tell them or give them instruction that put the toys in that bucket, they will not be able to. Difficulty in organizing anything, right? Then often avoids, dislikes, engaging in task. That is why many of the ADHD children you have seen, they do not like to work in schools. They do not like to work with peers, right? So they dislike it. And it's natural in nature. Next is...
Hello?
Yeah,
I'm so sorry. Yeah, Nancy, I had a question related to the points that you just told.
Yeah.
Can't follow instructions and different difficulty in organizing. So what is the difference here? So is it not that they are finding it difficult to follow instructions eventually?
No, so the thing is that when I'm giving instructions, so they are not following that. Organizing tasks can be by themselves also. So nobody is giving them instruction. They are sitting with their toys. They have to keep them in a bucket. Naturally, they can't do by themselves also. So that is the difference. So here in the second line, if nobody is also giving instruction, they are not doing that by themselves also. No motivation is there. So that is the difference.
Sure. All right. Thanks so much.
Okay. Now the next is, that is why you see problem in schoolwork. That is why you will see problem with peers. That is why you will see problem at home. These are the 3 areas where you will see problems: home, school, and with peers, with any of the buddies, right? Next, often loses materials. Forgetful behavior is there. They are able to forget, right? So they lose materials. Next, distracted by extraneous stimuli. I'll explain you this, don't worry. Distracted by extraneous stimuli. Stimuli basically here means anything that is there in the immediate environment, right? Distraction here means, for example, they are sitting in a classroom, teacher is saying something, and let's say a laborer is working outside their classroom, right? So his attention or her attention will go there or extremely be diverted there only. He or she will not focus anywhere in the classroom, right? Or on the teachers. So extraneous stimuli basically here means external environment, right? Even at home also, for example, if the mother is teaching, and let's say, and there is news running on the TV and the father is watching the TV. So this child will eventually move out of the room, go and see the TV, right? So it's not because, see, if you might think that with other child also this happen, their attention is diverted. But listen to me very carefully. When you sit with the child and when you are trying to teach the child, right, any of the simplest instruction also, they will have a look at you, they will understand, they are receiving also and they are retaining also any of the instruction you are giving to them, either 50%, 10%, 20%. With ADHD child, their attention is completely diverted. So they are completely restless. What next? What next? What next? This is the process that they follow, right? Okay. So, and the last one under inattention is forgetful of daily activities. Daily they are brushing their teeth. Daily they are tying their shoes. They are buttoning their shirts. Daily. These are daily activities. But they are forgetting that. Okay. So these are the symptoms under inattention. Listen to me very carefully. When the child is 12 years or small, below 12 years or 12 years, this inattention must have 6 symptoms. If you want to diagnose a child who is under ADHD, who is under inattention, 6 symptoms must be there if the child is 12 years or below. Right? If the child is 12 years or above, that means only 5 symptoms you have to have. 12 years below, 6 symptoms in inattention. I have given you the symptoms. From this, you have to have 6 symptoms under inattention. Is it clear? Okay, perfect. Now we come on to hyperactivity. Hyperactivity and impulsivity are together. So first was inattention, second is hyperactivity and impulsivity together. Start writing down. I'm telling you the symptoms. Fidgeting with or taps hand or feet. Fidgeting with or taps hand.
Hello, ma'am.
Yes, Dr. Shraddha.
Yeah, you mentioned under 12 years inattention is for 6 symptoms.
Yeah.
So what are that 6 symptoms? Is it the same, this restlessness, impulsivity and all that?
No, I have told you 1, 2, 3, 4, 5, 6, 7, 8, 9. Almost 9 symptoms I've just told you, na, under inattention.
Okay, that's
You
the
need
same
to have
thing.
at least 6 when the child is 12 years and below.
12 years and below have to have 6 symptoms. And
Exactly.
you mentioned about that 6 years also. If he is under 6 years, then
Under 6 years. I've never said that. I said that below 12 years and above 12 years. Above 12
Okay.
years, 5 symptoms. Below 12 years, 6 symptoms.
Okay, fine. Okay, thank you.
Okay, Dr. Shah. Now, under hyperactivity and impulsivity, fidgeting with or taps hand or feet or squirms in seat. What is squirming? Hilna. He's sitting at one place squirming like this. Understood? Okay. Now I have told you or, which means either he is squirming in seat or he is fidgeting or he is tapping the hands. Teacher is giving instructions. Like this, either, or either. Understood? Perfect. Now, the second symptom is leave seat in situation when remaining seating is expected. Examination hall, lectures, discussion, PTM.
Please repeat the
Which one, Manvi? The second point.
Fidgety, squirming, and
The first one you are asking?
yeah,
Okay. Fidgeting with or taps hand or feet or squirms in seat. This is the first point. Right? Okay, moving on. Second is leaves seat in situation when remaining seated is expected. I'm giving you examples, discussions, lectures, right? PTMs, anything that is extremely important. The child will unable to pay attention. The child will leave the seat, right? Okay. Third is often runs about or climbs in situation where it is inappropriate. So a discussion might be going on in an amphitheater. The child goes and climbs up the stage. In front of 350 people, 250 people, he is not aware, she is not aware. What are they doing, right? So the lecture is going on and they are doing that. Right? Okay. Now, side by side, why am I giving you examples so that you understand, right? You can
No,
write
excuse me.
those examples also.
Can you
Yes,
just
Pavit.
repeat this point once again?
Third point.
The third point?
Third, yeah.
Yes.
Okay.
And
Often,
if it is
often-
possible, excuse me, if it
Yeah,
is
yeah.
possible, थोड़ा सा slow dictate करें तो लिखने में हो
हाँ,
जाएगा.
ठीक है,
Thank you,
ठीक है,
thank you.
thank you for it. Okay. So often runs about or climbs, often runs about or climbs in situation where it is inappropriate, right? So let's say I give you the example, a lecture is going on, PTM is going on, extremely important, you have to focus, but the child doesn't know, does anything which requires your attention, right? Next is unable to, okay, somebody has raised hand. Yes, Mandan.
Ma'am, are we just talking about kids in this situation
No, no.
when
I'll
we're talking
come
about
on
ADHD?
to adults also because
Okay.
I'm just going sequentially.
Okay, right now we are just talking about kids.
I'll tell you that why am I talking about kids? I'll talk about adults also in this only.
Okay.
I'll just go sequentially.
Okay.
Okay, so clinical people, counseling people, relationship people, don't worry about that. I will be talking about adults also. ADHD is there in children and adults. I'm just going sequentially. So nothing is left. Okay, perfect. So the next is unable to play or engage in free time activities. Now understand free time activities here could be sports period, art and sculpture period, painting, any hobbies, going to the park, leisure activities basically, right? Okay. Next is often on the go, often on the go means that he or she is always ready just to go anywhere, right? So that is what I was saying, that what is next? So they are restless from inside, right? That this activity is completed, I have to do something else. That activity is completed. For them, that is completed, but it's not completed. As I said earlier also, for example, if you give them a test, right? And that test requires at least 2 hours. So they are not able to finish the paper also. and then before 2 hours they will submit the paper. So they are not able to finish. It's not like that before 2 hours they are finishing the paper. So they are not able to complete tasks, but they are in a complete hurry. That what next, what surprising or what exciting is coming on the way, right? So always on the go. Next, often talks excessively. Often talks excessively. Next, blurts out an answer. Blurts, B-L-U-R-T-S, blurts out an answer, which means they are sitting in a writing paper, that is an assessment, but what will they say? They will be vocal about it. Right? So any question, who is the Prime Minister of India? They will be vocal about it. They need to write it down, but they won't understand. Okay.
Could you repeat that, please? So sorry.
Yeah, blurts out an answer. Bhumika, you can look at the chat box also. B-L-U-R-T-S, blurts out an answer. Okay.
I have the question.
Oh, Om Prakash, yes, bataiye.
Whether it may be possible also the childs or adults that they may not answer anything, just looking on you. You are asking something and they are not answering.
Om
Just
Prakash, you got frozen in between. Can you just repeat?
I'm asking the question that the child who is below 12 years or above 12 years, sometimes if you ask them some question and they don't answer, they will just seeing on you, they will looking on you. Whether it is possible, this is also like that?
No, because this comes under autism. This specifically comes under autism with hyperactive people, with hyperactive child. They are looking to give you answer, but they will give, either they can give a wrong answer or they can give a right answer, but they will brat out the answer. Right?
Okay.
Yeah. Next is.
Ma'am, one question.
Yeah, Ronnie.
So, one hyperactive kid which I'm aware of, okay, but he is intelligent also, ma'am. Like, for example, he blurts out answers, and sometimes those answers are like, thought provoking. Like, he's hyperactive in terms of like, quick answer, goes on the stage like, with confidence.
I'll just come to that, Ronnie. But quickly summing it up, Ronnie, ADHD children have high IQ.
Okay, got it.
Right, have high IQ. I'll come to that, but they have high IQ. Okay. Now the next is difficulty.
Okay, thanks,
okay, thank you. Difficulty in waiting for turn. Difficulty in waiting for their turn. Lum, can you mute yourself? Lum. It's a humble request, guys. Please mute yourself. If you don't have a question, just mute yourself. Okay. Next is often interrupts or intrudes in others. Often interrupts and intrudes in others, which means 2 or 3 people are playing and they will, just barge in. The child goes and disturbs them, right? So this is intruding. Or let's say on a road also, if the ADHD child is there or ADHD adolescent is there and the mother is taking them to the market, what will happen? 2-3 people are standing there, they are talking, the child will just barge in, right? So between the conversations. Okay, now this was hyperactivity and impulsivity. Hyperactivity and impulsivity also have the same criteria. Children below 12 years should have 6 symptoms. Same criteria. Children above 12 years, 5 symptoms. At least. Right? So why I told you this? Extremely important, because as a counselor or as a psychologist, how will you observe? When I say observation karni, here observation means that you will see this criteria, and then you can say, okay, there can be a possibility that this child have ADHD. So for that possibility and for that observation, you need to have this criteria. Understood? Okay. Moving on. Now, just for your understanding, major symptoms are developed when the child is almost 12 years. Major symptoms are developed by then. When the child is almost 12 years, major symptoms are developed by then. Yes, Manvi.
Ma'am, I wanted to ask that if there are major symptoms and if they are developed by 12 years, तो मैम ऐसा होता है कि ये कभी क्योर नहीं होते कि क्योर हो जाते हैं? Because बहुत बार ऐसा होता है.
Manvi, a lot of disturbance beta from your end. Okay. So, I think she is asking about the curability.
Yes, ma'am.
Okay. So, curable, curable, it's not curable. It's treatable, it's manageable. Guys, do you want this session to continue? Then I require that you please maintain some, decorum from your side, because it's highly distracting in between.
Yes, ma'am. You are the host. I think you also can mute everybody.
Yeah, I've just muted, but I had to give rights to everyone because you guys need to ask questions. That is why I have given. It's my humble request to all of you. It's very distracting.
I'm really sorry for the inconvenience, ma'am.
Yes, Manvi, it's not about you. It's for everybody else also, right? Okay. So guys, it's not curable, but it's treatable and manageable, which means you can treat ADHD and manage the symptoms, but it's not curable. Since it's a neurodevelopmental disorder, if you relate to that, neurodevelopmental means it's from the conceptions, right from the starting, right from the birth, right? I will come to that, how is it related, but just telling you it's not curable. This you should have in mind, but it is treatable and manageable. And if you are able to manage something, then you are able to talk to that person, right? So manageable thing can happen. Symptoms I've just told you. Now dysfunction, किस level पे हो सकता है? What is dysfunction? Anybody who can tell me what is dysfunction? So I've told you what is disorder. What is dysfunction?
Ma'am, may I?
Yeah, Kushal.
Yes, I think dysfunction means not able to do something in a particular way. Like if there is something that needs to be done in a particular way, some action needs to be done, and if the person is not able to do it properly, then it could be dysfunction, I think.
Okay, so I think you got confused. Manjusha, same with you, you got confused. The thing that you are saying, the brushing thing and everything, that is disorder, because you have an order in life and that get disturbed, that is disorder. Dysfunction is different. Yes, Jan.
Hi, ma'am. So, according to me, dysfunction means that there's some abnormality or some, for example, some impairment. If some person is not able to see, that can be called as dysfunction of any body part.
Right. Thank you, Janet. So basically,
Physical
there are
problem.
What just happened? Somebody said something.
Somebody was saying physical problem.
Physical problem. Okay. Thank you, Purabi. What is dysfunction? You have body parts, you have limbs. So any problem in that activity, right? Any problem there, limbs, hands, legs, feet, any abnormality is there. So, and see, this is a might thing. That is an assumption. It's not that every ADHD child will have some abnormality or every ADHD child will have some problem. It's not there. Not all of the times. It may happen. right? Dysfunction could be there. Now, understand this very clearly. Yes, Mannat.
Ma'am, so they have a dysfunction because they have ADHD or because they have
The other way around.
Yeah.
See, because this is a neurodevelopmental problem and they are running parallelly, so it could be both the ways. Because they have dysfunction, that is why they have ADHD, or they have ADHD, that is why they have the dysfunction. Because this is running parallelly since it is from the birth.
Okay, ma'am. So it's not compulsory, like if someone has one thing, so they would have some issue or some sort of dysfunction.
No, it's not required. Yeah.
Okay, but it is one of, like, is it an important point that it is usually in a lot of
Could be one
cases?
of the factors. So suppose you have 100 ADHD children or 100 ADHD adults, right? All the functions in them will not be same. Some may have 6 qualities, 6 signs and symptoms. Some may have 12 signs and symptoms, right? That I will tell you. We have levels of severity. Then I'll tell you how is it related. Okay. So listen to me very carefully right now. So we have 3 things, 3 parameters. Either an ADHD adult or a child can have a combined problem. Combined problem means inattention plus hyperactivity and impulsivity, right? So either a child can have a combined problem, hyperactivity, impulsivity, all 3 are there. Impulsivity, hyperactivity, and inattention, all 3 are there. That is a combined parameter. Second, only inattention. There might be a ADHD person who only has inattention. And the last one is hyperactivity and impulsivity. There might be a person who only has hyperactivity and impulsivity. Understood? Never get confused that this child doesn't have hyperactivity. This child doesn't have impulsivity. Never get confused. There are 3 things. The child can lie on either of the parameters. Understood? Okay. Then there are levels of severity. We have mild levels of severity.
Excuse me, ma'am.
Yes, Farooq.
All these problems, if means they must be having from birth, if they are not attended by any means or any therapy, will it go increasing? Means the situation will go bad from.
I'll come to that. I'll come to that, Farooq. I'll come to that. Right? Okay. Yes, Ambika. I'll just repeat. Which point do you want me to repeat? The parameters one.
Yes, ma'am. Parameters one.
Right. So we have 3 parameters. First is combined. In combined, we have inattention plus hyperactivity plus impulsivity. All the 3 are present there. The child has everything or the adult has everything. Second is only inattention. That the child doesn't have hyperactivity, doesn't have impulsivity, only has inattention. And the last one is hyperactivity and impulsivity. Always remember, hyperactivity and impulsivity will go together. Understood? Ambika? Written?
Yes, ma'am. Yes, I wrote it down.
Okay. Yes, Nandini.
Ma'am, as you said, that there are 3 parameters combined: inattention, hyperactivity, and impulsivity.
Right.
So, would they have different names for those disorders or just ADHD? Because considering that when you're inattentive, it's just the attention deficit part, and when you're hyperactive, it's just
I'll tell you. Nandini, ADHD is an umbrella term. Under this, we have subsidiaries. Right? So that is basically the subsidiary.
Only if it has center open.
Please, you mute everyone.
I just don't.
We'll be talking on the chat only.
Ma'am, is it
Mute
possible
everyone.
that you mute everyone unless and until the class is over so that all the questions also will be asked at the end, because it's highly getting irritated right now.
Yes, ma'am.
Done, guys. And I was not doing that because since you guys are adults and you might have questions, right? So that is why I was not doing that. But okay, anyways. So yeah, Nandini.
So, ma'am, it's basically an umbrella term, and that would include all of these, and there's no other name for it.
No. There is no other name, beta. That is an umbrella term, ADHD. Under that, we have inattention, hyperactivity, and impulsivity. So there is no other name.
Okay. Thank you.
Okay. So next I was talking about levels of severity. Now understand what is severity. Severity here means, and please keep this in mind for every mental disorder. Those who are especially pursuing counseling psychology and clinical psychology and child psychology also, there are levels of severity now, which means that if there are 3 ADHD children, 3 ADHD adults, my severity level could be 50%, his severity level could be 30%, the other severity level could be 20%, which means that I have high signs and symptoms. I manifest that behavior in a more severe level. That I have behavioral tantrums also, I have many signs and symptoms also. The next person who has the severity level of 20% might be having only 3 symptoms. Right? So it depends. Again, what are the levels of severity? Start writing down. First is mild level. M-I-L-D, mild level. Please keep these notes somewhere, very carefully, because they will be helpful to you when you practice, right? So just keep your notes very carefully with you, right? Okay, so we have mild level. Mild level here means few symptoms, very basic, few symptoms. You can easily judge only 3 of your, while you are observing a child. So only 2-3 symptoms will be there. So it's easily guessable also that, okay, this child is mild. Easily guessable. 2-3 symptoms that will fall under mild category. Second is moderate symptom.
Nancy?
Yes, Bhumika.
Yeah, so the thing is, if it is 2 or 3 symptoms, in that case, it should not be an ADHD, right?
No, no, it will be in ADHD, but you need to understand, I'm just telling only about observing, right? We will come on to test, then I will describe. Only observing.
Yeah, I was actually trying to relate it with that particular point, like less than. Yeah.
Right. Bhumika, thank you. Basically, this is for only observing. Observing means that you suspect when a child has a problem. How do you suspect? Based on some symptoms. So these are those symptoms. Right. Okay, so Pratap has written somebody probably will be borderline. Borderline personality is completely different. Never get, confused with that. Borderline personality is different. That is called BPD. This is not borderline, right? So that is complete. This is purely ADHD. Now, we have severe. Severe means major of the symptoms, 15 symptoms, 16 symptoms, 20 symptoms altogether, that you can see everything. I'll come to that.
Sorry, Nancy, you did not told us about moderate. What will be the means moderate में कितना होगा?
I'm coming on to that. Okay, so we have 10 to 12 symptoms in moderate. Understood? 10 to 12 symptoms. Thank you, whoever pointed out. Sorry, I missed out your name. Then severe symptoms, we have 15 symptoms and above. Upper limit could be anything. Could be 30 symptoms, 40 symptoms, all symptoms clubbed together. Above 15 symptoms, severe. Understood?
But madam, you have given only 12 symptoms and 30 where we will find.
12 symptoms?
Hello?
Yeah, Vikramji.
Miss, you have given only the 12 symptoms, but 30 symptoms.
I'll tell you, Vikramji, these things that I've given you are the keywords, right? So under that you can, for example, I'll give you an example. Forgetful in daily activities, right? Forgetful in daily activities could be, I'm forgetting about brushing, I'm forgetting about cleaning my room, I'm forgetting about buttoning my shirt. So there could be n number of things. When you club all the things together, that will exceed 50 and 60. Understood? Are we on the same page?
Yes, ma'am.
Okay, wonderful.
Nancy, hi, Loisin here.
Hi, Loisan. Yeah.
Yeah, you've spoken about inattention and you've spoken about hyperactivity. I
Yeah.
don't know if you've spoken about the last one or the third one.
Irritability.
Loisan, actually,
Yeah.
inattention was a separate point. Hyperactivity and impulsivity is clubbed together.
Oh, it's clubbed together. Okay,
Yeah.
sorry, I missed.
Oh, no, it's okay.
Got it. Thank you.
Ma'am, there's a third point also, which is irritability, I think so, right?
Yeah, irritability, but that is a keyword, Ronnie. So we do not use it anywhere. So impulsivity can be used as irritability also.
Okay, ma'am.
Right. Okay. Severe, I have told you 15 symptoms and above. Written? Okay. Okay, who told me about this Vikramji? Okay, so now I'm telling you that how do you actually see? For example, I'm just giving an example. Suppose I told you hyperactivity. How can you figure it out? I'm just giving you certain examples. Excessive motor activity could be there in hyperactivity. What is motor activity? Anyone knows about motor skills?
Yes.
Usage of hands.
One by one, everyone. Who's speaking? Farooqji, I'll come to you. Yes, Kohumita.
Up to my knowledge, motor activity means physically restless or something.
Okay, Farooqji.
Continuously moving his posture or like that.
Okay. Guys, please raise your hand. I'll just come to you. Okay. Yeah, Paramit.
Ma'am, it is fine motor activity, gross motor activity, plus the other body movement. So it's basically even the way how they are holding, gripping things, everything is included in that.
Okay. Thank you, Paramit. Yes, Kushali.
No, I was also going to say the same thing. Body movements and actions is motor activity.
Okay, thank you, Kushali. Yes, Pavanti.
Basically, motor skills we teach the kids is tripod positions. So when the bacha is not able to do it in a proper manner, motor skill basically is a development of a holding things, if I'm not incorrect.
Okay, I'll just come to that. Well, so yes, Prashant.
Would you, by motor skills, would you say the same thing as you had mentioned that, fidgeting by the means of their hands and doing activities with their feet? So essentially, anything that requires your motor cognition using your hands and feet.
Exactly, Prashant. Yeah. Yes, Poonam.
Yeah, it's a coordination between mind and your movements, your physical movements, like it could be hand, body, any body part.
Okay, so it's a coordination between not mind and movements, it's a coordination between brain and movements.
Okay.
Brain
Okay.
is present there, mind is abstract, brain is an organ.
Okay, fine.
Okay. Yeah, Paramit.
There is also a high possibility that they will throw tantrums also, especially in the case of ADHD.
Paramit, I'll come to that.
Okay.
I'm so sorry. I'm just going in a sequential manner.
No problem.
Okay, okay. So basically, what is motor activity? Motor activity in short terms, or motor skill in short term, means that anything that is related to brain, eye, and hand coordination. Brain, eye, and hand coordination. And those includes your limbs. Those include your limbs. Upper limbs are what? Your hands. What are your lower limbs? Legs, feet, right? In
Yes.
motor skills, we have two things. Especially this is especially for child psychology people and clinical psychology people. What are fine motor skills and gross motor skills? We have two things. Anything that you hold from your palm, like I'm holding this bottle, this is gross motor skill, right? And anything that you hold from your fingers or your toes, right? That is fine motor skills. Use of fingers or toes. I'm holding a pencil, that is a fine motor skill. I'm holding a bottle, that is a gross motor skill. Understood? Any questions? Okay, whenever you have to mention something about mental thing, for example, I don't remember who mentioned about the mind. Always keep this in mind. Mind is abstract in nature. Mind is not present. Brain is present. Brain is an organ. Brain is present. Brain is there, right? So we always use the scientific terminology of brain, not mind. There is a difference. Mind is an energy bowl, something that is present in an abstract nature. Brain is there, right? Okay, moving on.
Excuse me, ma'am. You said mind is an energy goal.
Yeah, Vikram.
Okay, ma'am.
Nancy,
Yeah, Deepa.
you said holding, using palm is gross
Yeah.
motor skills, and using of fingers. What did you say that word? Use by the use of fingers.
That is a fine motor skill. Fine, fine.
Fine.
Fine motor skill.
Okay. Okay. Thank you.
Okay.
I missed that word.
Okay.
Thank you.
Okay. Now I was telling you about hyperactivity. So I'm just giving you some examples. Excessive motor activity, fidgeting, tapping, talkativeness, not sitting at one place. There can be n number of things. If you find 2 or 3 in them also, that is also fine. If you find 1 also, that is also fine. I'm just giving an example because I just told you individual differences are there. No 5 people or no 10 people can have the same signs and symptoms. Okay. Okay, moving on. With impulsivity, actually what happens, impulsivity is not there, is not very for you it's not very observable when the child is below 12 years, impulsivity especially. So I'm not saying it's not there, it's not very observable. Why I'm telling you and how? For example, a child is in preschool. Can anybody tell me what will his or her behavior be? First of all, you will raise hand, then only I will accept answer. Blurting out the answer, I will not accept. So if the child is in a preschool, how will be their behavior? The child is around, let's say, 4 or 5 years or 6 years. Yes, I think somebody has raised his hand. Poonam? Okay, I think Janet. Yeah, Janet.
So firstly, what comes to my mind is in the preschool, they would be crying because they'll not, they'll not want to go to school and sit in an environment where a lot of, kids are there. And second thing, maybe that they'll not listen to the teachers, what they tell. Because, and mostly they'll be crying.
So, actually, can you just put it in a word like sequentially? What are you trying to say? That we can't say that they are impulsive because they have their behavior like that, right?
Yeah, that's what I'm trying to tell.
Okay, Janet. Yes,
and very new for them, and it's very new for them, so they might take time to
so that
adjust.
is the reaction to the external environment.
Yeah.
Okay, okay, got it. Thank you. Yes, Debalakshmi.
A normal kid would often be distracted at the situation because of the crowd, and also they'll be not following instruction because of the person is entirely new to them. They don't want to interact with them at all.
Okay, okay, okay. Thank you, Debalakshmi. Yes, Ranjit.
Yeah, ma'am. A 5, 6 years old kid, maybe the kid is not able to sit in orderly and disciplined manner. Maybe the kid is walking too much or and not sitting on his or her seat. Maybe the kid is as you said, hyperactive. So too much running, jumping, causing irritability to class and interrupting other kids in a group.
Right, right. Thank you, Ranjit. Yes, Pratap. So quickly we will have answers. Yes, Pratap.
So because of the mischievousness and playful nature of the kids, usually we cannot find out impulsivity because impulsiveness means they grab the opportunity to be impulsive. So in case of mischievousness and playful nature of these kids, we cannot judge between if it is impulsiveness or ADHD.
Okay, okay. Thank you, Pratap. Yes, Kaushalya.
Yes, ma'am. That's what I thought, that all the kids in that age, they are very bubbly and they are running around, playing around.
They are very innocent also.
You cannot.
I'll just accept answers only when you raise your hand. Yes, Kaushalya.
So you cannot differentiate it easily because mostly all of them are of same type. They behave in a similar manner.
Okay. Thank you, Kaushalya ji. Yes, Loisen.
Almost, I think everyone said it, but I think kids are generally impulsive. They very, they very spontaneous. They just go ahead and do whatever they feel like doing. They won't think so much before doing anything. They are not aware.
Right, right, right. Who's there? Yes, Suma.
Hello, Nancy ma'am. Good evening.
Hi.
What I have observed, like small child, like whatever things come in their hands, they don't take it carefully. They just handle it very roughly, and they can even break the things.
Okay, okay. Thank you,
And
Sumanji.
try like they try to go everywhere, every nook and corner, and just touch things what is there and all. Like,
Right,
okay.
right. Thank you, Sumanji. Yes, Shalini.
Yeah, what I feel, for the first time, the kid is going out and he's meeting a lot of people. So maybe that crying and everything, it is because of the detachment from the parent or the excitement and that whatsoever we say, that impulsive behavior. It could be that kid is very happy going out of the house and he's meeting so many other beings of his own age. So I in both the cases, it's not very clear. Means if he's crying, he don't want to go out of his place. He don't want to go out of his comfort level. And if he is behaving too happy or like that, it could be because till now he's only with his parents or grandparents or maybe one sibling, but here he could meet with other beings of his own type, so that's why he's overly joyful.
Right.
So this Hannah, it could be because
Of that, right. Thank you, Shalini. Yes, Nandini.
Ma'am, what I feel like is children are basically, they don't really think before they do something or they speak something or they act in a certain way. So I feel like in that way we could say that children are impulsive. But if that causes a problem, if that is in an excessive manner, then we might be able to identify it, if I'm right.
Okay, okay. Thank you, Nandini. Yes, Paramir.
Ma'am, there is a high possibility the kid might be all over the place. It's very difficult to sustain attention. Especially if you would notice in their coloring pattern, they easily get bored. They will break the crayons. The coloring pattern would be very scattered, and there is a possibility like a group activity is going on, and they want to participate. They want to be the first one. If they are not given that first chance, they might be pushing, or they might get angry. There will be temper tantrums. So these are the certain observations which I've seen in a play school. So that's what I'm sharing.
Okay, okay. Thank you, Paramit. Yes, Poonam, quickly. I think nobody is left after Poonam. Okay, Poonam, lastly, we are taking an answer from you. Okay, yes, Poonam, quickly.
Yeah, usually I just saw like kids are not very, if they are in their comfortable zone, they tend to be more naughty and be themselves. They are more destructive, and these kind of activity where they can do whatever they want to do, either throwing things or destroying their toys or abusing anybody, or they are more or less like that kind of aggressive behavior if they are in the comfort level. If they are going into somebody's new place, first time they're visiting some place, I think at that time they are not very comfortable to show their all tantrums.
Right. Thank you, Poonam. Yes, Janet.
Yeah, similar to what
Kushali, I'm so sorry because you have given answer once, so that is why I didn't take to answer. Can you just write it down on the chat box? We have limited time. Thank you.
Sure, no issues. Yeah, thank you.
Yeah, yeah, Janet.
Yeah. So one observation what I have noticed in kids is that in order to get somebody's attention, they want to do something very impulsive. Like as in, yeah, somebody rightly said that they want to throw something, break something, break the crayons, break the toys, just so that somebody wants to. They want somebody's attention. They either want the teacher's attention or somebody's in the kids group only. They want somebody to see them. So is this also a this impulsiveness, if it is extreme, then can this be considered as ADHD?
Is this a question? I'll take it after the discussion.
Okay, yeah.
Let's take it after. Deepamani, do you have a question or are you adding up to this?
Yeah, I'm adding. I had a student in my class. So he was autistic, diagnosed as autistic. He used to bite cute children's, like whoever pretty girls, like he had that habit, like pushing towards him and biting them. So I observed in one student.
Okay, okay.
I just wanted to add that
Thank you,
point.
Deepamani. Bikramji, can you write whatever you have in the chat box? I'm sorry, I'm running late. Okay. So then we quickly come to, so I have to sum it up. So everybody has said it very tightly, but understand this, when the child is very small, right? So we can't say that the child is impulsive because naturally he is like that, right? So he's into that developmental stage, and everybody said it very correctly. All the signs and symptoms that you were telling is of impulsivity. So developmentally, when he is growing or she is growing, the child is like that. You will not be able to differentiate what is impulsivity and what is the natural behavior that is coming to the child. That is why it's very difficult to see any pattern of impulsivity and clear it out or differentiate it when the child is below 12 years. Right? Because this may be natural to him or her also, and that might be impulsivity also. Understand? Understood? Okay. Moving on. There are some associated features also with ADHD. What are associated features? With inattention, with impulsivity, or with hyperactivity. These also can be there. Associated factors that are called the add-ons. It might be there, might not be there, but you have to see in the child itself. While taking the case history, you have to see.
Please repeat, madam.
Okay, okay. So we are talking about the associated factors. What are the associated factors? So already we have seen inattention, hyperactivity, and impulsivity. So these are the add-ons. Means that these could also be there in the child. Not always can be there, cannot be there. It's in that position, right? So first is delay in language, motor or social development. Delay in language, motor or social development. Which means, language means when the child is 1 year old, he or she achieves speaking non-meaningful words such as baba, tata, when he is 1 year old, right? When there is delay in that is developmental delay. That could be because of ADHD. Could be. Again, you have to observe. But that could be because I'm telling you that this is language delay. What is motor delay? When the child is 1 year old, he needs to walk or he needs to stand properly. These are the milestones I'm telling you, right? All the clinical people, all the child people and the counseling, please focus. Also for the relationship people, but then these three are majorly important. Now, what is delay in motor activity? That the child was supposed to walk when he was 1, but he's not walking. Delay again could be a possibility of ADHD. Third, social development. When the child is 2 months old or 3 months old, the child needs to achieve social smile. What is social smile? Anybody who's coming closer to the child is smiling, not purposefully, like that only. You might have seen also, observed also in 2-month baby, 3-month baby. This is called social smile. When it is not achieved, could be a possibility of what? ADHD, again, social developmental delay. These are the critical things I'm telling you. Please note it down somewhere. It will be beneficial for you. So this could be a possibility. Again, the next point under associated features, after this associated features is done. Associated features, the next point is emotional dysregulation. Emotional dysregulation. What is emotional dysregulation? I do not know that in which situation, how am I supposed to manifest the emotions? If somebody has died in the family, am I supposed to be happy? Am I supposed to cry? Am I supposed to weep? Or am I supposed to be sorrowful? Right? I do not know that. So I'm not aware of my emotions. This is emotional dysfunction. It could be in happy situation also, positive situation, could be in negative situation also. Always keep in mind. Okay. Then we quickly move on to development. Okay, so when the child is almost 4 years old, this is under the heading of development. When the child is almost 4 years old, almost I'm saying, you can diagnose ADHD. When the child is almost 4 years old, you can diagnose ADHD. Diagnose ADHD means you can start observing him. You can diagnose ADHD based on your observation. What did I just told you earlier? That impulsivity you can't observe when the child is below 3 years. That you can do when the child is above 4 or 5 years. That you can do, the observing behavior. Okay, now I'm coming on to the most important thing. Progenic factors. Progenic factors, Progenic. Progenic factors mean that why does ADHD happen? Progenic factors mean why does ADHD happen? What is the cause behind this? Right? Extremely important. First is, should I start telling you? Okay. So first is temperamental. First is under progenic factors. First is temperamental. Now, what do you mean by temperamental? Here I am talking about the temperament of a mother. Remember, I told you that it starts from the birth. It's a neurodevelopmental disorder. Temperament here means that what is the temperament of the mother? Is the mother too angry? Was the mother too angry when she started conceiving the child? Right? When the child was in conception, was the mother depressed? Was the mother on medications? Right? Was the mother smoking or taking any substance? All these things will come under. So temperament of the mother means any problem, physiological problem, psychological problem, social problem related to the mother. Because it's a genetic disorder, again I am repeating, it's a neurodevelopmental disorder. So for mother, it can transfer to the child. Genetics are into play, right? Okay, now next is environment. Yes, Aditi.
Okay, yeah, ma'am, I wanted to understand that on one hand, we say ADHD children to have good IQ, but also on the other hand, they have a lot of uh, intelligence difficulties. I won't say intelligence, but difficulties like delay in language, motor and social development. These two bits sound bit contradictory, but opposite, one side being strong with IQ and on the other side having basic delays in development.
See, here basically it means that if you are not able to concentrate, if you are not able to pay attention, that doesn't mean that you are low on IQ. Maybe you know better than the teacher. This is what the ADHD people feel. This is what the ADHD students feel. Maybe they are sitting at home reading their book and they have finished that book, that 60 pages book, 70 pages book in 15 minutes. For them, when you are teaching them in the classroom, it's all waste because they have finished that. So they are ahead of you basically, right? So it's not contradictory. Attention and concentration there means that you are not able to pay attention on the instruction, right? Remember I told you one point that often avoids and dislikes. So here, what is he disliking? That is of not his use. Go back to the case study that I've given you, right? Refer to that. You might be seeing one paragraph in which he dislikes what? He dislikes his studies because he is not able to focus. He is not able to put attention. That doesn't mean that he's low on IQ. IQ intelligence question is completely different from the study part. Intelligence could be, that is a completely different topic, but I'm telling you, if you read psychology in detail, intelligence could be specific intelligence also and special intelligence also. Special here means SPATIAL, spatial intelligence, right? So there could be general intelligence, spatial intelligence. That is when you read about psychology. Aditi, please refer to that, right? Okay. Somebody has raised. Yes, Alkendu, I'll come to you. I'll come to you. Don't worry.
No. I just want to ask one thing about this temperamental cause.
Yeah.
Is it only about the mother's anger, depression, or any smoking habits that may bring about ADHD, or is it also the father's
no, only
habits?
the mother. Only the mother, because she is conceiving, so only the mother.
Okay.
If
Thank you.
If in future there is a research, if the fathers can conceive, so then it will be the temperament of the fathers too. But now it's only the mother.
Okay. Thank you so much.
Hello, ma'am.
Yeah, sure.
Yeah. If the mother is in a conceiving period and in front of her, her husband or any man is smoking, so that will be passive smoking, I think.
Yeah.
So will it get affected to her?
Yeah, definitely. Because if she is into the same environment for 9 months, right? And this is happening again and again on the repeated mode, yes, that can affect the baby.
Okay.
Although that is passive, but yes, it can affect the baby.
Okay, thank you.
Okay, moving on, environment. So under environment, write down quickly, low birth weight. When the child is the child is below 2.5 kg, he is considered or she is considered as malnutrition or weak, right? So that is low birth weight. Again, situated to what? Again, situated to the conception. Then premature babies. Premature babies are what? 6-month-old baby, 7-month-old baby who's born, right? So that is a premature baby. Always remember, when you are taking case history and when the mother says, if you have already diagnosed and observed that the child might have ADHD, and then when the mother said that my baby was actually premature, low birth weight. Quickly, you can say it might be a possibility of ADHD. Although you will run the test, but this is how you link up things. That is why case history is extremely important. Okay. Yeah. So moving on, under this only environment, so any toxin exposure, maybe the baby is into the environment, for example, a laborer's baby who's working in a factory, right? So those smokes, lead exposure, so any kind of mineral exposure, right? Any kind of chemical exposure. That is why you might have seen, how many of you know about Bhopal tragedy? Just raise up your hand. Bhopal gas tragedy. Okay. What happened in Bhopal gas tragedy? That there was an exposure of gas, right? You might have seen that people have suffered till generations, that the babies were premature, the babies had infection. What is all that, right? Exposure to chemical, exposure to gas. This is how it is caused. Understood?
Yes,
Even
ma'am.
in Japan, Nagasaki and Hiroshima.
Exactly. Yeah. Yeah. Thank you, Vikram. Okay. Moving on, we have genetic and physiological factors. Under this only, genetic and physiological factors. Now, what are these? The mother was malnutrition. The mother has some kind of nutritional deficiency, or the child has some kind of nutritional deficiency, right? So vitamin C is less, vitamin A is less, anything of that sort, right? So this could be a possibility of ADHD. Okay, now progenic factors is completed. Okay, then quickly write down sex and gender. I'm telling you about the prevalence ratio. Sex and gender. This is a completely different topic, sex and gender. Progenic factors is completed. Now sex and genders. When there is an adult ADHD, females have more, males have less. Adult ADHD is there. A client who's coming to you, he's 28 years old. You might think, you might say, or you might observe that there will be more female cases, less male cases, right? And in child ADHD, just the opposite. More male cases, less female cases, which explains what exactly? That when you are growing up, females might grow that behavior, enhance that behavior. Males can control that behavior. That is naturally, not by external therapy. Naturally, it's happening, right? Okay. Now, these people can have suicidal tendencies also. Again, these are all associated factors. I'm just telling you verbally. These people can have suicidal tendencies. These people can have self-esteem issues. These people can have risk factors. For example, wrist cutting, harming behavior, right? All these things ADHD people can have. Okay, I think we have... Sane, you have a question?
Yes, I had a question, Nancy, but it was related to the previous topic. It was regarding the genetics of the child who is considered to have ADHD. So I was having this doubt that when the child is born to have ADHD, so it is during the development of the embryo. Is it why it is related to the mother only? Because if it is genetic, he should have the genes of both the mother and the father. So is it only the hostile conditions during the development of the embryo what causes the ADHD?
When we are talking about any neurodevelopmental disorder, we are talking about the third trimester here, when the brain is developing.
Okay.
Right.
All right.
This is
Only
how
when
you can relate.
during the development of the brain. So it
During the
completely
development.
depends on the mother. Okay.
Completely depends on the mother, third trimester, I'm so sorry.
All right. So even if the father has an ADHD problem, that's not going to affect the child.
That could be a possibility when we draw the family history. And suppose if not only ADHD, if in the family history we have a history of depression, We have a history of
Okay.
any of the mental disorders. Schizophrenia is there, depression is there, mania is there, bipolar disorder is there, OCD is there.
Alright.
Any of the mental disorder, there could be a possibility. Less
Okay.
possibility, but there could be when we draw the pedigree chart.
All right. All right. Understood.
Okay.
Thank you.
Okay. Okay.
Madam, shall I ask one question?
Yeah. Bikramji.
My question is that sometimes, which I have seen that the father is very, very hot temperament, and he is not good in the society also. But the son or the daughter also, they are going to that father's, characteristics level. So you said that it is about the mother, these things about the concept, these things. But father also is very wild in nature, and the son also is in that same character. So what is this? What is the conditions?
Bikramji, we are talking about the conception phase, when they have conceived the baby. So who will conceive the baby? First of all, the basic question is this.
Okay. One more question is that about the suicidal tendency. It is a hereditary, or it is grow according to the emotional factors. Is it a hereditary
How
factor?
will it be hereditary? It's not hereditary. When the ADHD has not given any intervention, when treatment is not there, therapies are not there, nobody is actually giving any kind of intervention. When the symptoms get worse, then you might have suicidal ideation or suicidal.
Because I have seen that in my society, there are 3 cases in the same family who died in a suicidal case. Mother also died in a suicidal case. Father also died, and finally the son also died in the suicidal. So what could be the reason for this?
There could be n number of reasons. There can be a family clash also. If I go in that way, there could be a history of mental disorder also. For that, I need to say case history. There could be anything. So that is not related to ADHD. I'm telling you about that. If you have an add-on factor, if you see an ADHD adult case, there might be suicidal tendency. I am not saying there has to be, there might be. Right? So do not link up suicide to ADHD. If by taking Bikramji's example, if somebody had a history of suicidal tendency, maybe the whole family was bipolar, or maybe the whole family was schizophrenic. But again, that is a journal statement. For that, you have to take the case history and you have to conduct the test. Okay. Yes, Farooq.
Ma'am, I have one question. My father is age of 88, and from last 5 to 6 months before his heart surgery, after his heart surgery, this kind of symptoms has developed. Means memory loss, hyperness, and getting angry very soon. So it's a kind of ADHD, or is he has also been diagnosed little bit of blood clot in his brain. So what could be this?
There might be a possibility that this is a bipolar disorder. Under bipolar disorder, we have cyclothymia and hypothymia also. So, Farooqji, it got frozen. Okay. I'll just repeat. Okay, quickly note down the treatment for Shalini ji, Sanya. I'll come to you. Once I complete this, I'll come to you.
Ma'am, please repeat the sex and the gender thing, ma'am, again quickly.
Okay, I'm repeating. Under sex and gender, females, when we are adults, so in adults, we have female high ratio, males low ratio. Under adults, we have female high ratio, male low ratio, just the reverse. In kids, in children, we have males high and yeah.
Okay, thank you.
Okay. Treatment, quickly write down treatment. In treatment, we have certain things that we do not give to an ADHD child or an ADHD patient ever. Sometimes what happens, the family doesn't know about it, but you as a counselor or a psychologist, you have to tell the family. Now, what we do not have to give the child or the adult, sugary things. Anything that is high on sugar. Right? And what do we have to give? Just write it down. What you have to recommend as a counselor. Green leafy vegetables. This is purely I'm talking about the diet. Green leafy vegetables. Second is whole grains. Whole grains as in millet, jowar, bajra, whole grains. Next is low fat milk. Low fat milk, yogurt, cheese. This you have to advise when you are talking to the family, right? Yogurt, cheese, more protein. More protein. After that, omega-3 fatty acids. Omega-3 fatty acids. Then a lot of water. A lot of water. Because water helps you to channelize. Right? So that is a lot of water. I'm just repeating. Those of you who have not written, green leafy vegetables, whole grain, low fat milk, yogurt, cheese, more protein, omega-3 fatty acids, and a lot of water. Okay. Yeah. I'll come to you guys. जिन्होंने हाथ उठाया है, I'll come to you. Just give me a moment. Okay. Quickly write down the assessment. There are 2 assessments that we have. Psychodiagnostic assessment that you can do as a counselor. There are 2 assessments for ADHD. First is ADHDT. ADHDT. Okay? The first one is ADHDT. The second one is Vanderbilt. I'm spelling it out. V as in van wala V. VANDERBILT. VANDERBILT. Thank you so much, Pratap. Because you guys, Ronnie, Pratap, you are writing down everything in the chat box. Hats off to you. Thank you so much. Okay, so I've just told you about the assessment. And last I'm telling about the therapies. This is the last thing. I'm telling you about the therapies. What therapies you can give from your side as a counselor. Okay, first is behavioral therapy that you can give. First is behavioral therapy. Second is social skills training. Teaching them social skills. How you have to sit in a school, how you have to sit at home, what you have to do in a routine, all the basic things. Social skills training. Third is parenting skills. As a counselor, you have to tell to the parents, psycho-educate them about the parenting skills. Right? How to maintain motivation, because with an ADHD child, there is a lot of rigor that is happening. The child is not sleeping, the child is super energetic, right? So how to be with that child or how to be with that adult, how to manage themselves and the child. So all the parenting tips. Then we have psychotherapy. For all the psychotherapy people, under psychotherapy, what will you do? Explore their negative thoughts. Under psychotherapy, what will you do? Explore their negative thoughts. And use talk therapy. This is under psychotherapy. Explore their negative thoughts. Right? And explore psychotherapy. How do you explore negative thought? When you are talking to a patient, you will explore and ask, okay, so what are you feeling right now? Any of the presenting complaint. What is the client feeling right now? What is the situation right now? That you have to explore, or the negative thoughts. I feel like dying. I feel like killing myself. I feel like running away from home. Any statement, any such statement. So you have to recognize that. And the last one is CBT, cognitive behavioral therapy. That is last one. What will you do under CBT? You will teach the adult or the kid about mindfulness activities. That is the last one. CBT, cognitive behavioral therapy. CBT. under which you will suggest mindfulness activities. What are mindfulness activities? Which help you to stay in the present situation, which help you to work on attention and concentration. Those are mindfulness activities. With this, ADHD is completed.
Mom,
Madam,
just
what
a
did you say? Number
question.
one, therapy number one. What did you say, ma'am?
I'm coming to all of you. Vikramji, I'll just take your question. Vikramji, the first one is behavioral therapy. First is behavioral therapy. Second is social skill training. Third is parenting skills. Fourth is psychotherapy. Under psychotherapy, I have told you explore negative thoughts and use talk therapy under psychotherapy. Then last one is CBT, that is mindfulness training. Okay. Okay, and now I'm coming to all of you. Yes, Shalini, do you have a question?
I just wanted to know that say I have teenagers at home. So what you told me, suppose that lack of concentration or impulsiveness or hyperactivity, these are the some common factors which we all are facing these days with the teenagers, right? So, can it be in ADHD? Because suppose till now my child was completely okay. So it could be age related, or is it a part of ADHD?
See, it could be anything. It could be age related also because puberty has hit them. So that could be one
Yeah.
of the reason. Or maybe
Yes.
they are too much into gaming. That is one of the reason. Or if you suspect
Definitely.
ADHD also, then also you have to go for diagnostic test.
Okay.
Right? Either the
Okay.
DHDT or the Vanderbilt. So that could be
Okay.
one of the reasons.
Okay. And the second question is that that prognosis that you told me under environment that you told me that it could be low birth weight, sorry, temperament of a mother, right? So it may does it also matter that it is not directly mother's temperament, but it could be environment of the family that she stayed in a lot of stressful family or in stressful environment. It could also affect the child means this thing.
Yes,
It could.
Shalinji, I think I've told you, all of you in one class, there are two things that are there and which we talk in psychology all about that is basically first is nurture, second is
Okay.
nature. Now, what is
Okay.
nurturing?
Okay.
You are in which kind of environment? Second is nurture. Sorry, first
Okay.
is nurture, you are in which kind of environment, second is nature, that is your biological component, the genetic
Okay.
factors, right? So that is
Okay. 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 Thank you so much. Thank you
okay,
so much.
Ma'am,
Acha,
just a
one thing.
quick question,
one
ma'am.
by
Sorry.
one by one, everyone.
No, just
Just a sec.
explain
Sorry.
AD is what is this assessment, ma'am? I want
I'll
to know
come to
about
you.
the
I'll come to
assessment.
you, Divyalakshmi. I'll come to you. I'll just come to
Yeah.
everyone. Yeah.
Yeah.
Yeah, Sanij.
One thing more.
Yeah, yeah.
जैसे suppose a child is at the time of birth, the child had great Asperger's points, right? That doctor, that is Asperger's points. I suppose I don't know the technical thing. So after in coming years, then the child is diagnosed with ADHD.
It could be one of the reasons. Again, you have see any which way you have to go for the diagnostic test. You can't be just based on the observation, but this could be a reason. When we take case history, this could be a reason. Then the child was into lead exposure or any of the chemical exposure. So that could be directly linked up to ADHD. But again, you have to go for the test.
No, that's what I'm asking you. That's what I'm asking you. At the time of birth, the pediatrician gave 100 matlab, very good marks for points for Asperger's test, that motor skills and everything. But afterwards, in coming years, Can the child be diagnosed with ADHD?
That is what I've just explained to you, half an hour ago. When we are talking about impulsivity, you can't diagnose it because Asperger's test is done when the child is almost infant or a child, right? So
Yes,
Asperger's test can be
definitely.
done there, right? So at that point
Okay.
of time, impulsivity is not explored. It is completely natural.
Okay.
That
Thank
is,
you so
it
much.
rules out.
Yeah. Okay. Thank you so much.
Okay.
Thank you. Thank you.
Yeah, Shalini ji. Yes, Anya.
Yes, Nancy.
Yes.
So my question is, I see that, all the ADHD patients or the children have more depression symptoms, most of them. So I see that, most of them are genetically transferred. Also, I have a question that is it possible that the environment of the child can cause ADHD also, because, probably mom has it. So genetically, it's not explored. If the mother has it, since the child is with the mother 24/7, is
No.
it possible for the child to acquire it?
If genetically, no, we can't achieve or acquire it. If that is genetically there, right, and it is happening because of the risk factor, the prognosis that I've just told you, then it could be the thing. For example, if the mother has ADHD, then it could be a possibility. But if the mother, it can come there and then, right? If I am the mother and I am conceiving the child, it can come there and then. There is no acquiring of ADHD. There is no acquiring of any mental disorder. Always remember that. You can't acquire
Okay.
any mental disorder. Either that is neurodevelopmental. Yeah.
Yeah, so certain habits can be acquired, if not completely, at least certain can few or certain habits can be acquired of ADHD.
No,
Not
Sanya,
so.
because all the neurodevelopmental disorder that are completely genetic in nature. So that is
Okay.
there, right? It will come from your genetics, or it will come from your mother, or it is hereditary in nature. So there could be something, for example, why I said nurture. Nurture here means when I am not taking care of you as a parent, right? So your
Okay.
nurturing can go wrong.
Okay.
Right? So that is
All
where
right.
that lies under social skills. So, but
All
you
right.
can't acquire anything, right? So that is it.
Okay. Okay. All right. So most of the symptoms which ADHD child has is because of the neurological problem, and not because of any other circumstances or situations around the child.
No.
It's completely neurological. Okay.
That is what
Okay.
I've just told you, the
All
neurodevelopment.
right. Okay. All right. Thank you.
Okay, Sandhya. Thank you. Yes, Kaushalya. Guys,
ma'am,
if
I
you just a second, Kaushalya. Guys, if we will have a question answer session also on Friday. If you have any question, this is purely about ADHD. If you have any question related to that, we can cater there also. Don't worry. Yes, Kaushalya. Yes, please continue.
Yes, ma'am. I just wanted to know that a counselor can conduct these assessment diagnostic tests.
Just for your use, you can conduct this. Just for
And
your
how do we get access to that, ma'am?
ADHD and Vanderbilt are available online.
Okay.
You can go to Google's write Vanderbilt or ADHD, they are available online. And if you want to search that how they are actually conducted, YouTube videos of full length of 1 hour, half an hour are there. That and step-by-step videos. Don't worry
Okay.
about that.
So we have access to that.
Yeah.
Yeah. Okay. Thank you, ma'am.
Okay. Kaushalya. Yes, Brindaji.
Ma'am, can you hear me?
Yeah, I can hear you.
Yeah. Sorry, ma'am. I was late for the first 5 minutes. I missed out the symptoms of inattention. The
All
first
the
topic, which should.
All the symptoms.
Sorry. The first topic, the symptoms for inattention.
That is what I'm asking you. Inattention. All the symptoms you have missed out.
Yeah. Yes, ma'am. Last two symptoms alone I have: forgetting materials and forgetting daily activities.
Okay. Can somebody share it for Brinda in the chat box?
Yeah.
Will
Yes.
that be okay?
Yeah. Yes. Fine, ma'am.
Okay. Thank you, Brinda ji. Yes, Poonam.
As I come to know about, this is a neurological disorder. So this is by birth only. It
Not
cannot develop it.
neurological, neurodevelopmental. Please get it very clearly in your mind. This is neurodevelopmental, not neurological.
Okay. So,
Yeah.
but it means it cannot happen on the later stages.
It cannot. No, it cannot.
Okay, great. And one more thing, like I have a child, like is my immediate neighbor. Same disorder. He is 18 years old now, but he's very, very aggressive. Sometimes they come to our house also, start shouting and trying to be very aggressive and killing others. So what should I do in that case? Like this child, I know he raised in front of me only. I love him so much. We don't do anything, but sometimes I get scared of like he may harm himself. Even the parents are not at home, they are not aware of where the child is. So I really feel very pity, what to do for that child.
Then see what happens when ADHD is not treated well, then it becomes conduct disorder. If conduct disorder is not treated well, it becomes oppositional defiant disorder, ODD. Now he has reached up to the stage that basically it is ODD, oppositional defiant disorder. For that he need a psychiatrist, not a psychologist. Because he was not treated when early intervention was not given, he was not treated well. Now this is ODD. So for that, he require a psychiatrist. They will prescribe him medicines. But that he might. So I'm not saying that they can treat him, but it's not curable. Basically, ODD also. So you need to consult a psychiatrist. You can give that advice because he's 18 years now. Okay. Okay, so we have yes, Manish.
सुबह मैं देख के चल दिया सर ये कहाँ है तुम्हारा केस
Manish,
केस है तुम्हारे पास है
yes, मेरे पास
फिर जाओ देख
yes, Manna.
Ma'am, so I wanted to know if aggression is one of the symptoms of ADHD, and another one, if the mother is, like you mentioned, video games. So if the mother is playing a lot of video games when she's bearing the kid, so would that also impact the kid?
Temperaments include everything, Manna. That depends on what duration and frequency she is playing. If she is too addicted to playing games, if she is playing violent games, right? If she is, too addicted to that on a frequency level that is high on frequency, duration is more, frequency is more, then it might impact. Yes.
Okay.
And
And
there
ma'am,
is exposure
aggression.
of the screen also. That is one thing you need to take into account. Lot of exposure also to the screen. That is why we tell the pregnant ladies to just stay away from the phone a little.
Okay. And is aggression one of the symptoms of ADHD?
It can be an associated feature. So it's not a preliminary feature, but it can be an associated feature because I'm too restless and too impulsive and I'm not listening to instruction. Nobody is giving attention to me, but I might turn, I can turn, what did you just say?
Aggressive.
Aggressive. Yeah, I might turn that, right? But it's not the preliminary one. Just forgot. Sorry. Yeah.
All right. Thank you, ma'am.
Okay, ma'am. Yeah. Okay, so yes, Alkendu. I'm sorry I kept you waiting. Now it's your turn, please.
Hi, ma'am.
Hi.
Actually, I have observed in my son, he is now 9 years old, but he's studying in class 1. And he has his problem is that he cannot communicate his feelings. But the other symptoms which have been discussed here, some of these symptoms are there also. So is it a case of ADHD that I can come to a
I'll give
conclusion?
you, just give me a moment. Others who are waiting for their 10, it's already 10:16. So this is the last question I am taking. Others who have question, please come on to Friday session. That is the question answer session. I will cater to your question there because it's already exceeded. I guess last, the previous day I've told you that we'll wrap up at 10, but still I'm taking question. Please, we'll we can stretch the class or we can extend the class to at least 10:05, but not more than that. I have been speaking all together from 8:30, right? So please, I just admire you all for this, and please, I will cater to your question in the Friday session. Keep those questions. I'm not saying I won't cater to that, but on a Friday session, right? Okay. Yes, sir.
Thank you, ma'am. Good night.
Good night. Good. Yes, Arkin.
Yes. In my case, my son is 10 years old. I have found some of the symptoms which you have mentioned here. I have found some of the symptoms present with him. But his main problem is that he is unable to communicate his feelings or unable to communicate at all. Form a word, he is unable to form word, like he understands simple instructions, or he goes to school, though he is studying in class 1 at the age of 9 years old age, but he doesn't communicate at all with us. So there is a language issue. Is that also a part of ADHD?
Alkendo, there can be many reasons. For example, if you are saying he is in grade 1 and he's 9 years old, right? Maybe in the beginning, he might have some of the learning problems, learning gaps, learning difficulties. So that could be one of the reasons. Can you tell me other features also, other signs, so that I can actually tell you if this lies in ADHD or not? Because some of the signs and symptoms, they overlap with other disorders also.
Okay, like he is never concentric. He cannot play. He is not interested in playing with some games or some things, but he is interested to mix with other people, other of his age. That he is interested, but he does not communicate by language.
He does not communicate by language, as in he is not speaking.
Yeah, like he just can say the basic things. Like if he wants to go to the toilet, he says, "Mom, toilet." So this is what it is.
Then there might be speech difficulty. You need to consult a speech therapist for that. There might be speech difficulty. Speech articulation is not there, right? This can be one of the component. So ADHD, I don't suspect this is ADHD. Might be delay in some developmental milestone when he was growing up.
Yes, there was delay. There was
delay,
delay in every sense, and there was also depression in the mother. Because at that point of time, it was just the wishes of our parents that we take up the child early. So there was a depression part on the part of the mother also.
Alkendo, have you consulted any psychologist?
Yes, I have. They have said that they are confused actually. See, I have gone to NIMHANS. So they
in
said,
Bangalore?
yeah, come again. Bangalore.
Bangalore, yeah.
Yeah.
Yeah,
So
yeah,
they
please.
have said that there is mild autism with ADHD, and they have referred to a doctor of NIMHANS who is in my state, that is West Bengal.
Okay.
So for follow-ups, and he is confused that whether ADHD is present or not, or
No,
is it just mild autism?
Okay, so understand it, Alkendu, there is something called as comorbidity. Comorbidity means that a person can have more than one disorder. There can be components in someone. For example, there could be autism that is more prevalent but can have features of ADHD. There can be OCD, more prevalence but features of ADHD. There can be a comorbidity also. So that might be a comorbidity. But again, you need to see which one is more prevalent. If I'm talking about autism, that is more prevalent. So the therapies are different for that. If ADHD is more prevalent, therapies are different. Tell your psychologist, whoever is doing that, has he run any diagnostic test?
No. He has
Then
just
he has to do a diagnostic test. Now, how can he say that it is autism and ADHD based on observation?
no. He's just going by the NIMHANS, the test conducted by in NIMHANS, and he is
That
going
is
by the
That is
NIMHANS
a completely
prescription.
different test. If you are talking about NIMHANS test, that is NIMHANS SLD test, specific learning disability. That is a
Okay.
completely different test. Tell him to either conduct ADHD or Vanderbilt so that he knows that on which parameters he is above. Is he into combined that I just told you? Does he lie under combined? Does he have inattention or does he have hyperactivity or impulsivity? Both.
Yes.
And
Yes.
if he is
These are the-
suspecting autism, then he has to do either CARS or either ESA. They are the name of the test. CARS, CARS, or ISAA, ESA. These are the tests for autism.
Okay.
So then only anyone could say that either he has autism or he has ADHD.
Okay. Okay.
Just on observation, they can't, and they are using NIMHANS. NIMHANS has SLD test. That is a specific learning disability. How are they telling that they have autism or ADHD? Please
I don't
clarify
know.
this, Alkendu, no?
Okay. Okay.
Tell them to do the specific test only if they are suspecting. I mean to say, if somebody has a problem in the liver, they can't do a KFT, a kidney test, na?
Yeah.
So that is the thing. If there is a problem in a liver, you will do any test related to the liver itself. You can't do
Yeah.
a kidney test. So that is the problem.
Okay. Okay. Thank you so much, ma'am. Thank you so much.
Okay, okay, Alkendu.
It is of great help to me.
Okay, Alkendu. Abhijit couldn't relate with you. If he can share the test with you, which test? The findings of the test you are saying, the result. Okay, Alkendu, if it is possible, and if see, complete confidentiality is there. If you want, you can share the findings of the test completely upon you. If you want, I can have a look at it.
Actually, the details were not shared with us. It was shared with the doctor from NIMHANS only.
They have not given you the result of the findings?
Yeah, they said mild ADHD, mild autism with ADHD.
No, this is not happening. Just ask them that if your test is conducted, you should, as a parent, should have the test, the result. They might be taking some money from you, and doctor has no relevance in this. Doctor is a completely different person who deals with physiological ailments, not a psychological ailment. Right? Alkendu, please take this into action. Tell them that I need the result findings. I need to have it.
Okay.
Because it is a child case and parents have the right.
Yes.
Why am I telling you? If this is an adult case, then the adult person, the adult client can say a no and maintain their confidentiality. In that case, we do not share any result of finding with the parents. But this is a child case. They need to share it with you.
Okay. Okay.
Okay.
They have just shared the diagnosis. They have not shared any test documents. Rather, they have kept it as a file in their hospital.
Then you need to have a look at it. What will they do only with the file? You need to have a look at it. See, if you get a prescription from a doctor, you need to keep that prescription with you, no?
Yeah.
What will happen if they will keep the prescription with themselves?
Correct.
Right? So just look into this matter. This is critical.
Okay. Okay. Thank you. Thank you so much.
Okay. Okay. And what were two more features, ma'am? Which one, Suma?
Associated features you are talking about, no? Impulsive and attentive, and two more you are talking about.
Okay, so first one was combined. That was inattention, hyperactivity, impulsivity. Second was only inattention. Third was hyperactivity plus inattention. Sorry, hyperactivity plus impulsivity. Yeah, third one was that.
Okay.
Okay.
Thank you. Thank you.
Okay, everyone.